Diseases of arteries. 1. Atherosclerosis. Atherosclerosis is a common and serious medical condition characterized by the progressive buildup of fatty deposits, cholesterol, calcium, and other substances within the walls of arteries. These deposits, known as atherosclerotic plaques, can narrow and harden the arteries over time, leading to a variety of cardiovascular problems. Here are some key points about atherosclerosis. Plaque formation. Atherosclerosis begins when the inner lining of an artery, called the endothelium, is damaged. This damage can occur due to factors such as high blood pressure, smoking, high cholesterol levels, or chronic inflammation. Once the endothelium is damaged, substances like low-density lipoprotein, LDL, cholesterol can enter the artery wall and initiate plaque formation. Plaque composition. Atherosclerotic plaques consist of a mixture of cholesterol, fat, calcium, cellular debris, and inflammatory cells. Over time, these plaques can grow in size and harden, causing the artery to narrow and lose its flexibility. Artery blockage. As plaques continue to accumulate, they can obstruct blood flow through the affected arteries. This reduced blood flow can lead to various cardiovascular problems, depending on which arteries are affected. For example, 1. Coronary artery atherosclerosis can cause chest pain, angina, or lead to heart attacks. 2. Peripheral artery atherosclerosis can result in leg pain, cramping, and poor wound healing. 3. Carotid artery atherosclerosis can increase the risk of stroke if plaques break free and travel to the brain. Complications. Atherosclerosis can lead to severe complications, including heart disease, stroke, and other vascular diseases. It is a major cause of morbidity and mortality worldwide. Risk factors. Several risk factors increase the likelihood of developing atherosclerosis. These include 1. High blood pressure, hypertension. 2. High LDL cholesterol levels. 3. Smoking. 4. Diabetes. 5. Obesity. 6. Lack of physical activity. 7. Family history of cardiovascular disease. 8. Age. Risk increases with age. Prevention and treatment. Managing risk factors and adopting a heart-healthy lifestyle can help prevent or slow the progression of atherosclerosis. Lifestyle changes may include quitting smoking, eating a balanced diet, exercising regularly, and controlling blood pressure and cholesterol levels. Medications such as statins, blood pressure-lowering drugs, and antiplatelet agents are often prescribed to manage atherosclerosis. In severe cases, procedures like angioplasty and stent placement or surgical interventions like bypass surgery may be necessary to open blocked arteries. Regular checkups, routine medical checkups, and cardiovascular assessments can help identify and monitor atherosclerosis. Early detection and intervention are critical for preventing complications and improving outcomes. 2. Hypertension. Hypertension, commonly known as high blood pressure, is a medical condition characterized by elevated blood pressure levels in the arteries. Blood pressure is the force of blood against the walls of the arteries as the heart pumps it throughout the body. It is typically measured in millimeters of mercury, Hg, and is recorded as two numbers, systolic pressure over diastolic pressure. 1. Systolic pressure. This is the higher number in the blood pressure reading and represents the pressure in the arteries when the heart beats and pumps blood. 2. Diastolic pressure. This is the lower number and represents the pressure in the arteries when the heart is at rest between beats. Normal blood pressure is generally considered to be around 120/80ths of a millimeter Hg. Hypertension is usually diagnosed when a person consistently has blood pressure readings of 130/80ths of a millimeter Hg or higher. Hypertension can be categorized into two main types. Primary hypertension, essential hypertension. This is the most common type of hypertension, and its exact cause is often unknown. It tends to develop gradually over time and is influenced by a combination of genetic, lifestyle, and environmental factors. Secondary hypertension. This type of hypertension is typically caused by an underlying medical condition or medication. Conditions such as kidney disease, hormonal disorders, and certain medications can lead to secondary hypertension. Treating the underlying cause can often resolve secondary hypertension. Hypertension is a significant risk factor for various health problems, including heart disease, stroke, kidney disease, and damage to other organs. It is often referred to as a silent killer because it can progress without noticeable symptoms until it reaches a severe stage. Causes and risk factors. A. Non-modifiable risk factors. Family history. Advanced age. Race and ethnicity. B. Modifiable risk factors. Stress. Smoking. High salt intake. Obesity. Hyperlipidemia. Coronary artery disease. Caffeine. Treatment and education. Managing hypertension typically involves lifestyle modifications and, in some cases, medication. Lifestyle changes may include 1. Eating a balanced and heart-healthy diet, such as the DASH, Dietary Approaches to Stop Hypertension diet. 2. Reducing sodium, salt, intake. 3. Engaging in regular physical activity. 4. Maintaining a healthy weight. 5. Limiting alcohol consumption. 6. Quitting smoking. 7. Managing stress through relaxation techniques. DASH diet for hypertension. The DASH, Dietary Approaches to Stop Hypertension diet is a dietary plan specifically designed to help manage and reduce high blood pressure, hypertension. It emphasizes nutrient-rich foods while reducing sodium, salt, intake. The DASH diet has been shown to be effective in lowering blood pressure and improving overall cardiovascular health. Here are the key principles of the DASH diet. Fruits and vegetables. Consume a variety of fruits and vegetables daily. These foods are rich in vitamins, minerals, fiber, and antioxidants. Aim for at least 4 to 5 servings of each per day. Whole grains. Choose whole grains over refined grains. Opt for whole wheat bread, brown rice, whole grain pasta, and oatmeal. Aim for 6 to 8 servings of grains per day. Lean protein. Include lean protein sources such as poultry, fish, beans, lentils, and tofu in your diet. Limit red meat consumption, and when you do eat it, choose lean cuts and control portion sizes. Nuts, seeds, and legumes. These are good sources of protein, healthy fats, and fiber. A handful of nuts or seeds or a serving of legumes can be included in your daily diet. Dairy or dairy alternatives. Opt for low-fat or fat-free dairy products like skim milk, yogurt, and cheese. If you're lactose intolerant or prefer non-dairy options, choose fortified soy milk or almond milk. Limit sodium. Reducing sodium intake is a central component of the DASH diet. Aim for no more than 2,300 mg, mg, of sodium per day, which is about 1 teaspoon of table salt. If you have high blood pressure or other risk factors, such as being older than 50 or having diabetes, aim for an even lower sodium intake, around 1,500 mg per day. Limit sweets and sugary beverages. Minimize your consumption of sugary snacks, desserts, and sugary drinks like soda and fruit juices. Moderate alcohol. If you choose to drink alcohol, do so in moderation. For women, this means up to 1 drink per day, and for men, up to 2 drinks per day. Portion control. Pay attention to portion sizes to avoid overeating. Measuring food and using smaller plates can help control portion sizes. Monitor nutrients. Keep an eye on your intake of nutrients like potassium, calcium, and magnesium, which are important for blood pressure regulation. These are found in abundance in fruits, vegetables, and dairy products. Stay hydrated. Drink plenty of water throughout the day. Reducing your intake of sugary and caffeinated beverages can help maintain proper hydration. Gradual changes. If your current diet differs significantly from the DASH diet, make gradual changes to allow your taste buds and habits to adjust over time. Medications, such as diuretics, beta blockers, angiotensin-converting enzyme ACE inhibitors, angiotensin II receptor blockers, ARBs, and calcium channel blockers, may be prescribed by a healthcare provider if lifestyle changes alone are insufficient to control blood pressure. Hypertension complications. Stroke. Myocardial infarction. Renal failure. Heart failure. Vision loss. 3. Orthostatic hypotension. Orthostatic hypotension, also known as postural hypotension, is a medical condition characterized by a sudden drop in blood pressure when a person transitions from a lying or sitting position to an upright position, such as standing. This drop in blood pressure can lead to symptoms like dizziness, lightheadedness, and in some cases, fainting, syncope. Orthostatic hypotension can be caused by various underlying factors and medical conditions. Here are some key points to understand about orthostatic hypotension. Causes: dehydration. Inadequate fluid intake can lead to a decrease in blood volume, making it more likely for blood pressure to drop upon standing. Medications. Certain medications, such as blood pressure medications, diuretics, antidepressants, and medications for Parkinson's disease, can lower blood pressure and increase the risk of orthostatic hypotension. Autonomic nervous system dysfunction. The autonomic nervous system helps regulate blood pressure, and dysfunction in this system can lead to orthostatic hypotension. Conditions like Parkinson's disease, multiple system atrophy, and diabetic neuropathy can affect autonomic function. Aging. As people get older, their bodies may become less responsive to changes in position, increasing the risk of orthostatic hypotension. Pregnancy. Changes in blood circulation and increased blood volume during pregnancy can make some women more susceptible to orthostatic hypotension. Certain medical conditions like diabetes, heart problems, and nervous system disorders can increase the risk of orthostatic hypotension. Symptoms of orthostatic hypotension typically occur when a person moves from lying or sitting to standing and may include: 1. Dizziness or lightheadedness. 2. Blurred vision. 3. Feeling faint. 4. Weakness. 5. Nausea. 6. Palpitations, feeling of a racing heart. 7. Sometimes fainting. Diagnosis. Diagnosing orthostatic hypotension involves monitoring blood pressure and heart rate in different positions. A healthcare provider may perform a tilt table test or use a blood pressure cuff to measure blood pressure while the person is lying down, sitting up, and standing. Treatment and management. Treatment and management of orthostatic hypotension depend on its underlying cause. Here are some general strategies for managing the condition. 1. Increasing fluid intake to prevent dehydration. 2. Gradual changes in position, for example, sitting on the edge of the bed for a few moments before standing. 3. Adjusting medications under the guidance of a healthcare provider. 4. Wearing compression stockings to help improve blood flow. 5. Elevating the head of the bed, especially for those with symptoms during sleep. 6. Increasing dietary salt intake, under medical supervision, to help retain fluids and raise blood pressure. 7. Addressing any underlying medical conditions contributing to orthostatic hypotension.